So we just had a follow-up visit with our patient here who is shoulder and hip, actually came in with hip issues, has been in the military for several years and had shoulder issues that they kept on saying these won't get any better. So when he came in for the first visit, actually said, you know, my shoulder's really screwed up. I can only move it this far, but you're never gonna get that any better. So go ahead and take both arms up over top. Good, and back down, and then out to the side. So here's the affected shoulder that wasn't going to get any better, that nobody could figure out, that he did dry needling and cupping and all the PT crap for, that we fixed in 2 visits. So the interesting thing is, when we were just on the table and I was working on this shoulder, he was talking about how he didn't have to think for this to work when it's working normally. After we established normal facilitation, now he feels normal contraction. So just go into what you were saying about what the difference was before treatment and after treatment.
Before treatment, you know, you give me resistance, and it's like my arm didn't know how to move. I had to think about it, and then it was the muscles were mushy, wasn't effective, and now it does it instinctively.
So that's the difference between re-educating patients on the neurophysiological level and just throwing exercise at them. So if I throw exercise at them, he would say that's mushy. I don't feel like I can use that. It feels stiff when I try to move it. That's because on the neuromuscular level, it's dysfunctional and cannot function normally. So when I would go and refacilitate the inhibited muscles, he would say, wow, that's really tender. Like, how'd you know to go to that spot? I know to go to that spot because he failed the test. So if he fails the test and says that's mushy and that's weak and that hurts, I can go directly to that neuromuscular junction, which is going to be extremely, well, sometimes extremely point tender. And he's going to be like, how did you know that was a spot that didn't hurt when I moved? Well, it didn't hurt when he moved, but it also wasn't firing, which decreases his motion and decreases his strength. So after I facilitate, now the mushiness is gone and it feels like it contracts the way it's supposed to. So that's the difference between doing the normal mumbo jumbo stuff that he did for years that doesn't work, trying to force things to move with mobilizations and passive range motion, trying to force things to get stronger with corrective exercise, which actually made him worse because you can't make a muscle exercise if it's inhibited. So you made the impingement worse and decreased range of motion. So that's why when you take the course and you learn how to use the 180 system, you get patients that get better even though they were told they couldn't get better because they've got all these joint dysfunctions. He had joint dysfunction because of the root cause of neuromuscular inhibition. All I did was reverse inhibition and joint dysfunction went away. Make sense?
Yes, yes it does.